And
I
so
mean,
let's,
it feels a lot looser,
yeah.
and I'm starting to be able to move my fingers more,
Okay.
so I feel good about it.
So when you say you're starting to be able to use your fingers more, can you maybe just describe that a little bit?
Okay,
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
So what can I do to help today? Any questions for me, or you'd like to go through an assessment? What can I do to be most useful for you?
I was just wondering, am I showing improvement? I mean,
Yeah, let's take
I
a
mean,
look.
I've really been trying. I mean, I
Yeah,
would
so
say.
while I pull up your data here, Nick, remind me, when did you start using your device? And you're using the Motus hand, correct?
Right.
Okay. Remind me how long you've been using it?
Probably 3 weeks now.
3 weeks. Good. Yeah, I see you got about 20 hours of rehab in, so good work there.
Yeah, I've
Um,
been trying.
what's that?
I've been trying.
Yeah, no, that's good. That's good work. So I would say this, you've had a 4% increase in your range of motion, which is really good. And you actually been increasing actually yesterday, 2 days ago. What was that? Wednesday. Wednesday looks like a super day for you, where you were on doing about 180 minutes of rehab, which is a bang up day. So good work there. I will also say this with respect to the progress, the range of motion is increasing. That's good. The other thing that's also improving is your forces that you're putting out. So you're actually getting some increases in your the forces that your muscles will be able to put out. So I'm seeing progress, even though we're 3 weeks in, but we're so it's still relatively early on in your use of the Motus hand, but all the signs right now are positive.
Okay, good.
Yeah. And
I
so
mean,
let's,
it feels a lot looser,
yeah.
and I'm starting to be able to move my fingers more,
Okay.
so I feel good about it.
So when you say you're starting to be able to use your fingers more, can you maybe just describe that a little bit?
Okay, not so much my thumb, but my four fingers in the front. I can actually bend them closed and they'll open.
Nice. Okay, good. Now, do you think that's a function of the fact that you're having less like tone there? And what do you think that's coming from?
I'm not sure.
Okay. Okay. But you said your fingers, you kind of feel more loose. So that's a good sign as well. That's one of
Yeah.
the quickest things we see as well in terms of just changes. So I'm not surprised that's happening. But I'm also really encouraged that you're getting some more use of your fingers. That's really good, something to latch onto. Now, that being said, let's go look at what games you're doing right now. And how are the activities going for you? Any ones
Good.
you like, any ones you don't like?
I don't really like the Motus Pet one.
Okay. Well, thankfully, when we work together, we can always take things off. So your Motus Pets is gone. No more of that. Now, with respect to your other activities, which ones do you like? So you had 7 minutes on Motus Pets. I could reallocate that time to some other exercise.
Let's see. I like the Cosmic Tennis. That one really makes you work.
Okay, good.
That's a good one.
Okay. Well, just increase the time there. So that's good to go. Now, Nick, on your side, do you have your Motus hand on right now?
Yes.
You do. Okay. Would you be up for checking ranges of motion real quick as just as an assessment?
Yeah.
Perfect. Let's get to it then. Okay, so on your side, let's go ahead and let's make sure we're getting connected here. There we go.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
Perfect. Okay, so Nick, on your side, I'm going to have you try to move up as far as you can for me. Really try to go up as far as you can.
All right.
And let me know when you think you've gotten all the way up.
All right.
Good. Now try to go down as far as you can in a flexion for me.
All right.
Good. Nice work. Okay. Really good. So good. Some good flexion there. That's good. Now I'm going to go and stop this. Now on your side, go ahead and just relax for me. I'm going to go ahead and move up in some ranges of motion. I'm just going to check your tone. So let me know as soon as you feel the Motus hand move you.
Okay.
We'll keep going up. You feel it move you yet?
No, not yet.
Okay.
There it goes.
Good. Okay. And we'll keep going up here.
Okay.
How you doing so far, Nick? Any discomfort there?
No, it feels good.
Perfect. Okay. I can already tell, I think we're going to probably move up some ranges of motion if you're okay with that.
That's fine with me.
Okay. Good. Okay. Now what's the number you see on the left-hand side of your screen?
48 point.
Perfect. Very good. Okay. So should go down to 0 again in the center.
Yep.
Great.
There it goes.
Good. Okay, Nick. So I'm going to go ahead and actually increase that range of motion. I think you're already demonstrating some increases there. And so I'm going to go ahead and bump that up.
Okay.
So on my side, you should be good to go.
Okay.
Okay.
All right.
Any other questions for me? What we can do is we can actually have you go into game like Pamela was doing, and actually we can go through a couple of those exercises to make sure it's working for you. So if you want, go ahead and hit the back button in the top left.
Okay. All right.
And from there, I'm going to have you hit the home button.
Okay.
And once you're to home, I will have you hit begin therapy.
Okay.
And that'll pull up our activities. And I actually increased your thermometer settings as well, in addition to your strongman, your cosmic tennis, and all those.
Okay, cool.
So you should be good to go, my friend. We moved you up 10 degrees total on those exercises. So you should be having a bit more.
Yep, it sure is.
Okay. Is it uncomfortable or are you okay?
No, I'm fine.
Okay. Good. So what we'll do then, Nick, is like I did with Pamela, I'm going to have you continue through these couple of exercises. If you do come to the assessment, feel free to skip it because we just did it.
Okay.
But go through the thermometer exercise. Let's see, the next one you have up is strongman. And if you can, go ahead and get to the cosmic tennis one. And I want to see how that's working for you.
Okay.
And then I will circle back around and see how things are going. I'll be watching your data come in while I do this. And that way, if you see anything that's pausing your screen, don't worry. That's just me making a modification to your settings. And you can go ahead and just hit play if that happens. Okay.
Okay. All right.
Any other questions for me?
Nope.
Perfect. Okay. And let's go ahead and make sure that we get you scheduled too, because I want to make sure that we regularly check in with each other. I think it's important for us to do these regular check-ins, and we can ask those questions about how things are progressing and make modifications as needed to continue to push. Okay.
Okay.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.